Thank you, everyone. We're all ready to go. Thank you very much. A lot of progress here today. Thank you very much. Today we're announcing a new $500 million health infrastructure fund to support the rollout of our significant upgrades of hospitals around the state. As you know, at the budget we allocated $3.2 billion to support new health infrastructure around the state, and the Minister for Health and the Minister for Health Infrastructure are working hard to deliver the most significant transformation of our health infrastructure we've ever seen. So together, of course, with the new Women's and Babies Hospital, we have significant projects around the state. The $500 million fund is as a result of better than expected end of year outcomes that we anticipate for the last financial year, 24-25. On Friday, we'll be releasing our annual report of state finances. It is going through its last audit check with the Auditor General, but we are anticipating significant better position in relation to both the operating surplus and our net debt position. We're in a position now to allocate $500 million to a fund. That fund will support the rollout of our existing commitments and also make sure we can move quickly to support new projects. One of those will be the oncology unit at the Geraldton Hospital, with $38 million being allocated to get that project done as soon as possible through the variation of an existing contract where the redevelopment is underway. So this is a product of our good financial management. We continue to make sure that we prioritise our financial management, but together support the rollout of health infrastructure around the state. You see here the incredible progress of the new ICU, of the expanded ICU unit here at Charlie's. This will again support an expansion of the ICU capability, and it's on top of the extra maintenance funding. And just before we arrived here, the ministers and I had a quick peek at the maintenance rollout that's already happening as a result of the $50 million allocation that we made last month. So we're seeing significant works, over $114 million being spent here at Charlie's in relation to capital upgrades, the new maintenance. That work is rolling out now. We're already seeing the physical new look of the hospital, and we've seen that just before we popped into here. So some incredible work that's being undertaken, a lot more to do, and we're very committed to rolling out improved hospitals and health services across WA. And now I'll throw to Meredith.
Thank you. Thanks, Deputy Premier. It's great to be here today for this significant announcement of $500 million into a health infrastructure fund that will allow us to continue the important work in terms of building infrastructure for Western Australians, no matter where they live in this state. Our government's clear that one of our priorities is making sure that West Australians have access to the healthcare that they need, and this will ensure that our health infrastructure commitments are able to be supercharged so that we can continue to deliver the important infrastructure. Comes on top of significant funds invested by this government, $14 billion into health services, and is a demonstration of our ongoing commitment to deliver the health services that West Australians need. I'll now hand over to Mr. Perry.
Thanks, Meredith. As you know, we're doing everything we can to bolster the capacity of hospitals across Western Australia, and this new $500 million funding injection is a powerful demonstration of that. If you look across WA, hospitals are being transformed, whether it's Mullawa, Laverton, the single biggest spend in regional Western Australia in Bunbury, but also, of course, Geraldton, a range of step-down facilities through the north, and of course the Women's and Babies Hospital build. So what you're seeing here is a major transformation of hospitals across Western Australia, and this funding will ensure that we continue to roll out our infrastructure upgrades and new builds. This will take the total expenditure on hospital infrastructure to now $3.7 billion. So be very clear, our message to West Australians is health is a critical priority, and this funding boost demonstrates clearly that. Now, the first drawdown from that fund, as the Deputy Premier has mentioned, is $38.5 million for the oncology unit as part of the Geraldton Hospital redevelopment. As you know, we're investing around $180 million in a major redevelopment of Geraldton Hospital, and that is anticipated to be completed next year. We made a clear election commitment to fund a new oncology unit to improve cancer services, obviously in Geraldton and the Midwest. So this is the first drawdown. We are making a contract variation, and what this means is this decision will enable us to deliver a new oncology unit faster and also cost effectively by adding it on to the existing redevelopment. So again, all the investment you are seeing, we are undertaking a major that was for effect. We are undertaking a major transformation of public hospitals across the system, and this $500 million represents our serious commitment to achieve that. Happy to take any questions.
Is it a concession that the infrastructure need in health was previously underestimated?
No, look, I would say this. First of all, is we are already undertaking systematic transformation across our public hospitals. But what we do know is, in this current construction market, you do face cost escalations. And also, we are looking at our projects and how we can get them out the door faster. We made a significant change in terms of the delivery of major hospital infrastructure, and it has gone partly unnoticed, and that is that all major hospital projects and those challenging regional health projects now sit within the Office of Major Projects. So this fund will be used for projects like Royal Perth Hospital and the Peel Health Campus redevelopment, where we acknowledge there is capacity to do additional investment.
Is this dip in and out of it when you identify an area that needs to be fixed?
Well, look, I'll let the Treasurer explain the process, but in effect, decisions will be made, including at mid-year budget year review, but it will be in accordance with budget processes.
So is the 500 million, how much of it is covering just cost escalations on projects that have already been announced, and how much is for new projects?
So I need to be very clear on this, that these projects, that will be part of the budget process and be determined then. But I'll give you an example. At Royal Perth Hospital, a business case has been done, but we do have the Office of Major Projects looking at that business case, looking at the particular locations and seeing how we can deliver it as quickly as possible for best value for dollar. Similarly with Peel Health Campus, we've been on the record, we're investing $152 million in stage 1 works. Now these are the critical works to expand the hospital. That includes a new central energy unit, a major substation and energy, but we do anticipate that there will need to be further investment for stage 2 of Peel Health Campus.
Can you now give a firm timeline for the completion of the Peel Health redevelopment and the start of construction of the RPH redevelopment?
No, I can't at this stage. You can expect announcements. What I have said about Royal Perth is that we expect a contractor to be on board next year. I'll be in a position then to provide a clear time frame. I want to be clear on Peel Health Campus, and I was only out there in the last few weeks. This is going to be a big build. It requires all this basic, and I understand it sounds boring, but all of the critical infrastructure to make that happen, including the substation and the central energy plant. But I expect with the Health Minister, the Premier and the Deputy Premier, we'll be able to make announcements over the next 6 months in relation to both those projects.
The AMA says the crucial problem in our hospitals is a lack of beds. Where are the beds going to be?
Well,
where are the beds in this?
So, it will fund extra beds. We have, as part of our pipeline of new hospital upgrades, there will be a significant expansion of beds being created, whether it's at Peel Health Campus. It is about boosting capacity. The Royal Perth emergency redevelopment is about creating more capacity for bays and so forth. These lights are really dramatic, isn't it? It's like I look like a vampire. What I want to assure you is this money will bolster the capacity to deliver critical projects that will expand the number of beds in the system.
I know it won't cover. Sorry, I know it's not going to cover what the AMA says is required, which is basically the number of beds contained in a full brand new hospital.
Yeah.
So how many beds would, are we looking at? And
Yeah, so we, look, Jeff, and you've got to remember this can change as particular hospital operation models come in place, but we believe that we've got an estimated 900 beds in the system, in the pipeline, from all the investment that we're making across all hospitals.
Charlie and Royal Perth have been in the spotlight a lot about crumbling infrastructure. What are some of the priority projects here with about 500 million?
Well, can I say this? Again, all of these decisions will be subject to the budget process and mid-year review. But can I make this point? We are already investing $140 million in Charlie's Hospital, and that doesn't include now the maintenance blitz. So that covers, we're investing $114 million in the new ICU where you're standing right now, in a new emergency department, and also coming to completion is the cyclotron and clinical spaces. So there is a massive investment already happening at Charlie's Hospital, and if there needs to be further decisions, then we can draw down on that fund. And right now, the maintenance blitz that we promised is happening. You can see it in action. It's happening right at Charlie.
The statement in June, a statement from the government in June, priced the Geraldton Oncology Unit at 30 million.
Yep.
Why is it 38 million now? And does that include the Commonwealth portion of funding?
So that is the estimated cost. As I've indicated, I think I've been on the public record. We do anticipate for the particular projects, particularly regional projects, you do get cost escalations. For example,
$8 million in 2 months.
well, it's not, I mean, they've made that assessment. I rely on the advice, and this is the best way to deliver the project most effectively. So we don't make these decisions on the run. The clear advice to me is this. First of all, it is far more effective in terms of time frame and value for money to add that build to a current redevelopment underway, rather than going out to a separate procurement process that will take longer and the advice is will be more costly. So yes, it is costing more, but it is a worthy investment to deliver that project.
It's costing more, but your government went to the public to say, you told the public it was going to cost $30 million. So
wait a minute, what's the criticism here? I'm spending too much money on health to deliver projects?
Well, you've gone to the public with a figure in order to get elected, and now it's gone up $8 million in 2 months.
So if the criticism that we're investing in health, then I'll take it. If the criticism that we want to deliver this project as quickly as possible, I'll take it. I'll cop that criticism.
Isn't it that you've deliberately underestimated the cost of these projects?
No, because we do business cases, we take the advice at the time. You then go out, for example, on many health projects, you go out for procurement and then the market can say something different. As I've been on the record, I've been really upfront about this. We go out to health projects where we don't get a tender, there's limited tenderers, or we have to extend the tender process to encourage people to tender. So can we be realistic and pragmatic about the current construction environment that is not just affecting housing, but also affects health construction? And the extra difficulty with health construction is you're having to do it in a 24/7 live environment. Now, not every builder and not every construction firm wants to deal with that environment. So let's not underestimate the challenges, but we are committed to delivering these projects. These projects are critical.
Could one of these projects be building a new tertiary hospital? How much of that 500 mil could go towards that, given that's what doctors are calling for?
I understand that's what they're calling for, but I would say this. Number one, let's focus on all the massive construction program that we've already got underway. I mean, I think sometimes we get a glib response of you're just doing that, Mullewa, Laverton. We are undertaking a systematic transformation of hospitals across Western Australia. We're doing a massive build with a women's and babies hospital. So let's not underestimate the investment that is being undertaken to bolster the capacity. So decisions relating to future hospital planning Of course, the government is always looking forward, but ultimately this fund is focused on the delivery right now.
For you and Charlie, there were concerns about a $3 million shortfall. Will that come out of this fund?
So I need to be very clear that the construction works is fully funded. The other elements, which is relating to on-cost, agency costs, always are considered afterwards, but the construction works are fully funded and this project will be delivered.
Can I just confirm
2027.
the Peel Health Campus, so the money from this fund, that's going to be spent on stage 2, it's not for any stage 1 work?
No, stage 2. Yeah.
Questions for Minister Hammett?
Are there concerns about the quality of drinking water at Royal Perth Hospital?
Well, look, I want to be really clear about the drinking water at Royal Perth Hospital. The Chief Health Officer, his advice is that the water is safe to drink. The most recent advice that had circulated at Royal Perth Hospital didn't relate to the quality of the drinking water, but related to hygiene practices, where sinks being used for people to wash their hands, if it was then subsequently used for drinking water, there's some concern about infection control. The Chief Health Officer has been very clear. The water is, in his advice to me, that the water is safe to drink, and that's because of the testing regimes in place and the work that's done to remediate it.
But then they also ran out of, I was concerned they were running out of bottled water to provide.
So this is an operational matter for Royal Perth Hospital that they would deal with all the time in terms of making sure that they do have water for people who need it. My expectation is that they would be able to address those issues as and when they need to.
Fiona Stanley raised concerns about the hospital, her namesake hospital, cancelling an event featuring Garzan doctors in September last year. Is that a concern to you, and do you know much about what transpired there?
Look, I've seen Fiona Stanley's comments. I'm advised that the Chief Executive from South Metro Health Service has spoken to her recently. I don't have details about the particular event, but of course, we're concerned to hear that she had concerns about that, but I understand South Metro Health Service, the Chief Executive there, has been in contact with her.
Would you like to see those Palestinian doctors do that event and speak to the doctors at Fiona
This is
Stanley?
really a matter for our health services. They're delivering all sorts of training and education for their staff all the time. And I'm sure that they're looking at the ways that they can do that. So it is very much a matter for South Metro Health Service.
The Mental Health Commission's raised concerns that the rate of high psychological distress has doubled in 2 years. How much of a worry is that?
Well, we're fundamentally committed to putting more money into mental health services, and we've seen that in our budget commitments. Of course, we're always looking at what more we can do, and we know that mental health support takes many forms. Some of that is hospital-provided services, but some of it's also in the community. So we're looking at all the ways that we can provide the support that people need to make sure they can get access to the care when they need it.
One of those support services is the mental health emergency response line. It's been left unmanned a couple of times lately.
Yeah, so I understand this is an issue that East Metro Health Service is looking at. What's really important about that service is that there will be, people's calls will be responded to. So there are alternative ways that those calls are responded to. If people need help, they will get it.
There was no messaging service. People weren't responded to.
Well, my advice was that there would be alternative pathways for people calling that line. I'm very happy to follow that up. Yeah.
Given we're here today, how do you hope the expansion of the ED here will address demand? Like 8:30 this morning, triage 4 was almost 7 hours. We've got that expansion coming. What can the government be doing in the meantime to address that demand?
Well, look, we're always looking at what we need to do to make sure our hospitals have got capacity. That's why we've rolled out a range of initiatives. One of our key areas that we focused on is how we can provide support to older West Australians who are in hospital, fit to be discharged but have nowhere to go. So our Time to Think program has been really important in terms of providing transition for older West Australians out of hospital and into more appropriate care settings. That's a really important way that we are alleviating pressure on our emergency departments. Our EDs are full because our hospitals are full, and our hospitals are often full because of the difficulty in accessing aged care or in accessing those home care packages. We've also been engaging with the federal government to encourage and ask them to do more. It's not just an issue affecting this state, it's affecting a number of states. But we're also looking at the whole pathway of a patient as well. So by things like our WA virtual emergency department, so people can, before they call an ambulance or at the point they're seeking that sort of care, if they're suitable for a virtual consultation so that they can get access to it. But of course the infrastructure program is a big part of it as well, and that's why today's announcement is so important, $500 million to support that infrastructure program so that we can complete works like this, but also complete works at Peel Health Campus, Royal Perth, because they are fundamental parts of the puzzle as well. So we're really looking at all of the things we can do, and we'll keep looking for more ways that we can meet that demand as well, to keep people well, keep them out of hospital.
Just on aged care, have you received a briefing yet from Minister Sam Ray on how many of the 20,000 WA is going to be getting of the home care packages?
So we believe that the number of home care packages we have in this state is underdone relative to our population. We obviously want to see the federal government do more. I haven't had the feedback from him yet in terms of how those packages will roll out. But this is an ongoing issue. That we welcome the announcement of those additional packages, but we know there's about 8,000 people in Western Australia waiting for home care packages. So the federal government need to look at what more they can do about home care packages, need to look at what more needs to happen in relation to aged care as well. And as a state government, we'll keep looking at what we can do to support older West Australians as well.
Is there a target for how many beds all of these projects will add by when into the hospital system?
The infrastructure project?
Yeah, well, and just overall, like how many more beds is the government aiming to add into the system? Because I've heard hundreds, but I haven't heard a specific number.
Yeah, so it is hundreds of additional beds that will come online through these infrastructure projects. But we're not just looking at the delivery of beds in hospitals. They are important, but we're also looking at all the other ways we can deliver care as well. One of the things that we've increased focus on is hospital in the home, because for many people that is a better setting for them to get care, and it's clinically supported care delivered in their own home, which is often preferable for many people.
But no,
so
I think it's not just about beds. There's a big difference between adding 100 beds or adding 900 beds.
Sure.
What's the target?
Look, that's probably an issue to address to the Health Infrastructure Minister. We've got hundreds of beds coming on the system through the work that we are doing. We've already added 900 additional beds since 2021. So the work that we've been doing to increase the bed capacity in our hospitals, but increase capacity right across the system, has been ongoing, and we'll continue to do it. We know that it's an important issue, and we'll continue to be laser focused on it.
Questions for the Deputy Premier?
Treasurer, what in previous years when the state gets a windfall like this for its budgeting, what would that money normally be spent on?
Oh, we've done a whole range of different initiatives. I think in previous years we may have done some cost of living initiatives. I think we've done a previous health round. But this, as I said, as a result of the very strong financial management of the state, we've created a $500 million fund, and as has been outlined by the two ministers, this allows us to react very quickly when we're able to make some firm commitments. And the Geraldton Oncology is an example. We have a live process in front of us. We're able to respond immediately, draw that money down, vary that contract and get it done. I've got to say, working with both ministers and the Office of Major Infrastructure Delivery team, our focus is very much on delivery. And this allows us, in a sense, to make decisions as quickly as possible to get on with the delivery of our key commitments.
When did you realise that this money was freed up in the budget to have this $500 million infrastructure fund, and was that a result of all the health pressures that have been in the headlines the last few months?
No, it's in the end of year outcome. There's a couple of key things that changed. One of them was the timing of a payment from the Commonwealth Government. It came earlier than anticipated. So as a result, the end of year outcome is going to be a lot better than we anticipated at the time of the state budget in May. So there was some timing of payments from the federal government where we had understandings, and those timings changed. That's fine. So it does improve the financial outcome for 24-25. Look, what this enables us to do, and as has been outlined, it enables us to respond quickly where there's live procurement process. We're able to lock in those projects and move on. There's no doubt our focus is on delivery. We have got some incredible plans, whether it be the Women and Babies Hospital, whether it be what's happening in Bunbury or in Geraldton, of course Peel, Royal Perth, the regional hospitals around the state. We have an incredible range of complex projects to deliver It's all hands on deck to deliver those. It's our number one priority. We're throwing everything at it. I had to use the term from the Minister for Health Infrastructure, but we are throwing everything at it. And this enables us to get on and getting those projects delivered.
Is it really?
Do you expect that this is going to blunt the opposition's attack on you, because they've been at you for weeks and months over health?
Oh, look, the opposition will do what opposition does, and this opposition in particular, I think, criticises everything we do. So I suspect they'll criticise $500 million of extra funding for health. What this does is, as has been outlined, we have a big program of $3.2 billion of delivery. As I said, we've refocused the entire government to make sure that health is the key priority to get delivered. Now, they are complex projects. But what we've done is put the best people in charge of delivery. We're getting this project done. We've got Royal Perth, we've got Peel, but of course we've got the existing regional hospitals too. So this very much makes sure that we have the capacity to address any funding issues as soon as possible and get on and get the deals done.
Can you really?
Surplus increase?
I can't give you that total detail, sorry. There will be an announcement on Friday because it's going through audit with the Auditor General, and that's...
By at least $500 million?
Yes. Yeah.
Has this come a bit too late though? Has health just been significantly underfunded for just far too long?
Oh no, we've had massive increases in health funding over the past few years, and I think we're now, of course, at a record rate of $14.2 billion, but the rate of increase in hospital funding and health funding has been significant. What, as the Treasurer too, who meets regularly now with all the Board of Treasurers, all the Treasurers from other states, every state is experiencing this issue, and in particular every state is experiencing people with disability or people or aged care, sort of older people who are basically in our hospitals who could be moved to an appropriate setting. So this is an issue being faced by everybody. The numbers differ from state to state, but the latest analysis that the state treasurers commissioned an independent report and showed between any given night, and I think it's the figures both the Minister for Health and the Premier's raised, between 200 or 300 people in our hospitals that could be in a different care setting, a more appropriate care setting. So it is multifaceted, addressing the health challenge. It's more infrastructure. It's making sure we expand capacities at EDs, ICUs and also general beds. It's looking at opportunities in relation to aged care in particular. Because not only are we getting presentations which in some instances they'll be better presenting in a different forum, and in particular maybe in their aged care home, it's a length of stay too. And the length of stay is probably one of the biggest challenges in relation to older people, because if there's nowhere to go to, then it's tougher. That's why we've got the transitional beds, the time to think beds. They're initiatives that we've introduced to try and ensure people can have a pathway out of our hospital system. But on any given night, there are thousands of people in our hospitals across the nation who would be better served in an aged care environment.
Now that the welfare checks are done, are you considering whether to strip the naming rights off Optus for the stadium?
Okay, so in relation to the welfare checks, the police constantly are in touch with the families involved. So that's our number one priority, is making sure the families are taken care of. There's a coronial inquiry that is underway too, and of course there's investigations. As I said, I will let those systems be underway before any further comment.
How much?
Through the wheat belt and through the Midwest, which will help support the resilience of the network.
There is a large cohort in the community who don't like Optus's name being on the stadium now. What do you say to them?
Now, I understand that, and I understand their concerns, but as I said, at the moment, our priority is very much participating in the significant inquiries and working with the families. That's our priority, and I just think we need to make that our priority, and so we don't create any extra issues out there.
Can I ask you just on the fund again? Sorry, you mentioned that some of that money has come to you because of the Commonwealth bringing forward payments. Can you really claim that it was sound financial management if that's the reason for the extra?
That was a part of the improved financial outcome, not the entire reason of the change in the numbers. As I said, unfortunately, we're still going through the final audit process, and those numbers will be released in a couple of days. But look, what we continue to do, and has been reported by Stan & Paul's, is very much to make sure we deliver our budget better than we anticipated. This is yet another example of that. I mean, it's a big challenge. We're talking about energy infrastructure, we're talking about health infrastructure, to manage the rollout of this significant infrastructure upgrades while at the same time producing a really strong set of books. I'm proud we've got that balance there. We've got that balance much better than any other state. WA should be proud of our ability to deliver an incredible set of books and then deliver our record injections into health.
What do you make of the comments regarding Shalom House?
Sorry, I'll just take this one.
So what do you make of the comments made by Peter Lyndon James from Shalom House? Just made some anti-immigrant comments. Was forced to apologise. What's your government viewpoint on the matter? Yes, and the plans that there were rumours that Shalom House might be bringing 180 people to one of the protests that's coming up.
Yeah, look, I haven't had any formal advice about Shalom House. I'm not sure if my colleagues have. I don't think so. But I saw some of those comments and they were a bit disgraceful.
Can I just ask Minister Kelly, since Minister Hammett said I should have directed the question to you,
I think you mentioned 900 beds.
as a target?
Yes.
Yeah.
By
I think
when?
you said 900 in the pipeline.
In the pipeline, by when?
So,
How long's the pipeline?
well, the pipeline is all of the works being undertaken. So all the projects that we're committed to and rolling out, but that includes Peel, women's and babies, yes. All of the infrastructure program we're doing, we have an estimate of around 900. But I do note, and I need to be on the record, and I have been on this in the past, that once hospitals are established, operation decisions are made, there could be changing of beds and so forth, but that's the estimate.
Where's that maintenance order at? The maintenance order?
So that's underway. The work is being done.
When do you expect that to be finished?
Well, we said it would take approximately 12 weeks. I suspect we're about, I'd have to check from the announcement, we said it was around 12 weeks. But the point I want to make is the $50 million blitz, the money is already going out the door. You go downstairs, you can see one of the corridors. We're replacing the roofing. They have been really working hard, and the Department of Housing and Works has been assisting the Department of Health in locking down contractors.
Can I ask just the Trevor one more question? Sorry. The City of Bunbury plans to relocate the Bunbury bus station as part of their redevelopment. Will you commit to security at that bus station 7 days a week?
Okay, so in relation to that bus station, there is a plan for that entire precinct. That redevelopment of Centennial Park, including the relocation of the Shell, can happen with or without the relocation of the bus station. There are some people that don't believe public transport should be in the city centre. I actually believe it should. I actually think it brings activation. Now, in relation to, there are a couple of concerns in relation to the services for drivers. This is an issue we do face across the suburbs and in regional towns about making sure there's good facilities for drivers, like toilet blocks and so forth. So we're working with the TWU on that. And then in relation to safety, we're happy to work with the City of Bunbury about any perceived issues or real issues of safety around that station. We did that in relation to the Perth train station, where the City of Perth failed to, in a sense, look after that precinct. And so the PTA took that precinct over about 2.5 years ago. We basically now have transit officers who support security in that area. So we're very happy to work with councils about improving any perceptions or issues of safety around key areas. But I want to say this, that public transport should be in the city centre, and it is a part of activation, and I think having it in its current location is a good thing.
Can I just ask the Health Minister one question?
Last question.
There's all these expansions happening, but do we have enough doctors, nurses, specialists to actually staff them?
Yeah, well, we've made a real commitment to increasing the workforce in terms of nurses and doctors. So 5,000 additional nurses since 2021, 1,900 additional doctors since 2021 as well. And so we're continuing to make sure we've got a good supply of the workforce that we need. And as we open up new facilities, of course, they're a key part of making sure that we're delivering the healthcare for West Australians.
Thanks, everyone.
Thank you.
Thank you.